Hello, everyone. I wanted to warmly welcome each and every one of you to this Coverdell Conversation series. This is the first of our series. This webinar is being recorded, and I wanted all of you to know that. On behalf of USF World and the Interim Vice President, Kiki Karusun, Dr. Kiki Karusun, who has not been able to make it this morning, I wanted to warmly welcome each and every one of you. I'm Lynette Menezes, and I oversee global programs for USF Health, which consists of the colleges of medicine, nursing, public health, and pharmacy. I am delighted that all of you have been able to make it today. As many of you know, our Coverdell program is one of the leading in the state of Florida. We have 5 of these out of the 8 programs across Florida. It's across several of our colleges, and you will learn a little bit more about it later. USF has been involved with the Peace Corps volunteer program since 2003, and there's a lot of history. But one of the most important things I believe of the Coverdell program is our Coverdell fellows have already had experience working abroad. They're now here for some of their higher education. So truly global is local and local is global. Our fellows can apply some of their principles here to many of our communities here where they work, as well as, when you go abroad and learn about what they have done, you can apply those principles elsewhere as well. So with that, I want to have Jesse talk a little bit more about the history and some of the wonderful benefits this program has brought to USF, where we've had over 545 alumni of Peace Corps that have graduated in some program at USF. And this is a wonderful recognition for USF, as well as for all of you that are participating in this program. So again, I warmly welcome everyone. And Jesse will tell you a little bit of the history of the Peace Corps program before I introduce Dr. Barbara Smith.
Yes, so welcome everyone. My name is Jesse Casanova. I am the assistant director here, but I am very, very glad that I get to work across some of the colleges at USF Health and our Peace Corps partnerships. So originally, we started a partnership with Peace Corps. So USF had a partnership with the College of Public Health in 2003. And that partnership was with the Master's International program, which allowed students to both finish their master's degree and Peace Corps service simultaneously. And in 2016, Peace Corps decided that they wanted to focus more on the Coverdell Fellows program. So we shifted our focus along with Peace Corps to work with and to develop our Coverdell Fellows program here. As Dr. Menezes mentioned, the program is it's the largest in the state of Florida, since we have 5 colleges across the universities that really focus on working with our Coverdell Fellows and integrating a lot of their experiences into the communities. In 2017, we also were fortunate enough to apply and be accepted into the Peace Corps Prep program, of which we are now ranked the top 10 in the nation for providing Peace Corps Prep training to potential Peace Corps volunteers once they finish their bachelor's. But as we mentioned, we do have 5 colleges: the College of Nursing, the College of Public Health, the College of Global Sustainability, College of Engineering, Civil and Environmental Engineering, and also the College of Arts and Sciences, our anthropology department. And so as we continue to develop our program, we're very excited to be able to further develop and work with not just our volunteers and our Coverdell Fellows, but also with our partners in the field. So thanks, everyone.
Thank you, Jesse. And what Jesse Casanova forgot to mention is that he is a former Peace Corps volunteer as well. And that's one of the reasons that this program has, I think, been also successful, because he has been integral to starting it and working with the College of Public Health during the Master's International program. So thank you so much, Jesse. And I should have mentioned that when I was introducing you. And before I introduce Dr. Barbara Smith, I want to also welcome all of our international delegates who are here today to participate in this conversation along with our Coverdell Fellows. And I know that all of you are looking forward to it. So to introduce Dr. Barbara Smith, Dr. Smith is the director of our Global Health Program at the College of Nursing. at USF Health. She's a good friend and a very distinguished colleague with such a wealth of experience abroad. So I can't count the number of countries that Dr. Smith has been involved in building capacity in numerous countries across Africa. And most recently, he's also working with University of Del Norte in Barranquilla, Colombia, as well as with the Partners in Health program in Peru. So she is going to tell you a little bit more about the College of Nursing and their program with Peace Corps as well. Thank you, Dr. Smith, and welcome.
Good morning. Thank you for the introduction, Lynette. I wanted to also introduce Patricia Roque, sorry, and that from the College of Public Health. She's going to help me moderate because she certainly knows the public health Coverdell fellows better than I do. The College of Nursing has participated in the Coverdell program since, I believe, 2018. We admit 2 students per year to one of our 3 campuses, either the Tampa main campus or the campus in St. Petersburg, and also Sarasota Manatee. Recently, the 3 campuses joined into one entire program. The student that I am going to introduce this morning is Kara Rutherford, who served in Tanzania during her Peace Corps volunteer days. Unfortunately, she was one of the ones that was repatriated because of the COVID vaccine before the total completion of her 2 years. But she's had great experience and I think can offer quite a bit of insight into the life of a returning Peace Corps volunteer and participation in the Coverdell program. I'd like to now, I think, introduce Kara. She can talk a little bit about the country she was in and maybe even talk about her counterpart a little bit, even though I don't believe her counterpart is on this call this morning. Kara?
Yes, good morning. My name is Kara Rutherford. Like Barbara said, I served in Tanzania in 2019. I was part of the health and agriculture cohort. I specifically served in Singida, a central region in Tanzania. The counterpart that I invited, unfortunately, she couldn't make it because she had something come up, was one of the local teachers that I worked with a lot on many of my projects, and she gave me a lot of good insight and her opinions, which really helped guide a lot of my work on my project. Would you like me to go into a specific project?
Briefly, and maybe say a little bit about the community.
Okay. So I served in a village called Mohango. My counterpart was, like I said, a teacher there. So within our village, we had an elementary school, and then the high school that the students would attend was in a nearby, like, bigger village. And so I loved my village. Everyone was very welcoming and very excited for me to be there. I was the second volunteer there in my village, which is kind of a different experience than being the first volunteer there. So it's a lot of kind of like managing expectations and kind of like reintroducing what you're there to do. And so the project that I decided to talk about today is a project that I did with the teachers at the elementary school. It's called Huru International, and it focuses on women's health and reproductive health, focused towards like young girls, like teenage girls.
Patricia, I think you would like to introduce some of your Coverdells?
Of course. Hi, everyone. My name is Patricia Roque, and I coordinate experiential learning at the College of Public Health, USF. I am currently also the Coverdell recruiter at the college. It is very nice to meet you all, and thank you so much for joining us today. So at this time, I would like to introduce Connor McCarley. Connor, if you can please briefly introduce yourself, where you served.
Hello, my name is Connor McCarley, and I served from 2018 to 2020 in Guyana. I was in the health sector, and I served as an adolescent health promoter. So I worked mostly with the schools and a little bit with the clinics to try to help promote the communication and health literacy for our students. I was on the coast of Guyana, and so the way our community worked is it was one long road all along the coast, and so there was little villages and schools all across it. So I lived in a little town called Pomona, and we had a school called Aurora Secondary School, and that's where I worked. And I wasn't the first volunteer in my community, but the first for a long time. But also our region is where we would have trainings. So there was always volunteers and staff throughout the area, even if it wasn't always consistent. So, and the community was very used to Peace Corps volunteers as well. So that was a lot of help with getting things done within the community within my projects. And my main project was that we would work with teachers to train them to move away from the chalk and talk methods of teaching and more towards student-centered activities to get the students involved in defining their own education.
Thank you so much, Connor. And next we have Lucas Hicks.
Good morning, everyone. I served from 2017 to 2019 in Benin, a little country in West Africa, and I was a rural community health volunteer. So the breadth of our work was focused on a multitude of issues, but we kind of centered them around malaria identification and prevention, improvements of nutrition for children and for pregnant women, as well as focuses on preconception health matters across the board. The importance of getting all your vaccinations, of making it to all of your prenatal meetings at the health center. I was fortunate in a way to be the first volunteer in my site, in that I kind of got to lay the groundwork for Peace Corps activities in the site. My town of Lasame was in the southwest corner of Benin, and it was the county hub for 9 other villages that make up the entire community. And so I worked consistently at the health center to give out vaccinations to the infants in the area, to work with mothers and children on various health concepts. Unfortunately, my partner can't be here today. Christian Alokpo is the project manager for the Rural Community Health Division of Peace Corps' work in Benin, but I know that he's bummed out that he couldn't make it today. He had prior obligations, but he's been working with Peace Corps for a multitude of years, very passionate about improving women and children's health across the country. So great to be here discussing with you all today.
Thank you so much, Lucas. And next we have Naomi Hayes.
Hi, I'm Naomi Hayes. Kind of like Kara, we were both in the same cohort for health agriculture in Tanzania. But I focused mostly, well, we got 3 Tanzanian volunteers, so I won't go too much into it, but at my site, I served in a village called Makole, which was up in Lushoto. So very beautiful mountainous region, somewhat cold, but a lot of our projects focused on wash and nutrition and doing health education for mothers with young children. And I lived right behind the health clinic in my village. So it was very easy to coordinate with them. I also was involved with the school teaching English and biology once a week, but my main counterpart was a teacher there, and we coordinated a lot of projects centered around the students, but also at the clinic. But today I invited Jimmy, who is one of our program directors who was one of the program directors for health while I was in Peace Corps.
Thank you so much, Naomi. And finally, Tracy Gates.
Hello, everybody. My name is Tracy Gates. I apologize for any background noise. I'm excited to be here. I was also serving in Tanzania from 2018 to 2020, and I invited Clement. I'm super excited the Human Encyclopedia is here with us. Also nice to see Jimmy again. I was in the Southern Highlands region in Tanzania. I was an agriculture volunteer. I did several agriculture projects as well as some health focused projects. A couple of the projects I'm just going to mention briefly are we did a chicken raising project where we built chicken coops and made chicken feed and vaccinated the chickens. And we also did orange flesh sweet potatoes to promote nutrition and income generation as well. So I'm excited to be here. Thanks for having us.
Thank you so much, you all, for joining today. And Dr. Smith, I pass it on back to you.
Okay, I'd like to hear a little bit from Naomi and Tracy's counterparts in Tanzania, a little more about their village and a little more about what were some of the major problems and issues faced by those villages. So I think we should start with Jimmy.
Okay, thank you very much, Dr. Barbara. Most of the pertinent issues that are facing villagers, especially in the areas where we placed our volunteers, especially those health volunteers, we usually place them in areas where we have wash-related issues, sanitation and hygiene. I mean, in nutrition, for example, the area that we placed in Naomi in Lushoto is a very good area. They have a very arable land. But people were not really aware of how to prepare the food that is nutritious. They have everything there. They have avocados. They have all nutritious element things, but unfortunately, most of the things are being sold at the market instead of consuming themselves. So most of our volunteers, we are placing them in areas where there are those challenges. In wash-related issues, for example, the rate of cholera sometimes is very high in those areas. Typhoid diseases, etc., because people are not boiling water. Most of the water that are available are from the ditches and rivers. They are not treated waters, so most of the people are facing some health challenges. If I may talk a little bit about the HIV/AIDS, the prevalence of HIV/AIDS is quite high because people there, they don't have enough knowledge of preventing themselves. Widow inheritance is common in most of the areas. Access to health services, for example, condoms and other services are quite minimal due to cultural barriers. For example, some of the services they cannot be provided there because people might find it is kind of a taboo to talk all these sexual-related education, especially in schools and young people. So briefly, that is what I may say that the challenges we're facing in the areas where we place our volunteers. Thank you.
Thank you, Jimmy. I appreciate your input. I think we should move to Clement. Clement, could you, there you go.
Yeah. Hello, everyone. Hello, everyone.
Hi, Clement.
Hello.
Yeah, well, I've been working with Peace Corps for quite some time, and I was the food security coordinator, training volunteers counterparts on all things related to food security and nutrition during PST, IST, EST, and also we used to do some on-farm trainings wherever I visit the volunteers at their sites. And well, what I can say is that it's really nice working with volunteers, especially when they follow what you train them. So they were so good at transferring their knowledge the skills that they learn at different training settings to the counterparts and the community at large. And right now we don't have volunteers in the field, and the community is asking, when are these guys coming back? When should we receive them? We said due to this pandemic, it might not be easy to tell exactly when we should when they're going to come. But if everything works on well, hopefully we might receive them next year. Meanwhile, while we don't have volunteers in the country, we are doing some trainings related to food security and food and nutrition security to the counterparts who have been working with the volunteers, so that when volunteers come back, they will find them ready trained and they can work with the volunteers effectively. Any question on that? Hello?
Thanks,
Hello?
Clement.
Any questions?
Tracy is shaking her head
Can you hear
no.
me?
I don't think we have any questions yet, Clement. Thank you.
I'm sure we will later, Clement, as we
Thank you, Tracy.
proceed. The one thing that I was going to ask the student counterparts was, how did you learn about these pressing needs in your community? Was it through the counterpart, or was it some other way? So if you could just address that briefly, that would be great.
So Dr. Smith, before we go on to that one, I think we have coaches here from Uganda as well.
Ah, I'm sorry. And
forgive me if
could
I'm mispronouncing your name.
Unmute.
Okay, thank you, everyone. It's an evening here. Good evening, good morning, good afternoon, everyone. My name is Koshias Chukashaba, and I work with Peace Corps Uganda. I've been working with Peace Corps for about 10 years in different positions, from the technical trainer to the program specialist to, I'm now the program manager for health program. And through all that, I have really participated into the volunteer cycle in country, right from putting together what their job descriptions would be to preparing them even before they arrive, to pre-service training, to individual assessments for placement, to site placement, to site follow-ups, to volunteer individual support during their service until they close their service. And I would tell my volunteers that my most peak excitement point in Peace Corps was the COS moment, hearing those stories of the ups and downs, but people are like, oh, we've made it. So I'm glad to join this group, and I am open to any questions or discussions. I know I have met some staff in different capacities. I have met volunteers of different, diverse backgrounds, diverse experiences. I am happy to share my experience with you today.
Great, I'm sure we'll come back to you. So the students now will focus a little bit for a few minutes on student experiences and how they came to understand what some of the major needs were in their communities. So my screen shows people in a different order, but I'm going to call on Connor first.
Okay, thank you. So for our programming, they identified while working through the Ministry of Health that their high suicide rates and high teen pregnancy were a big problem within Guyana as a whole. So then as we got to our sites, what we did is we had like a time where we'd walk around our community, get to know all of our neighbors, all of the teachers, all of the children, and then we'd work with them we wouldn't say, oh, this is what we need to do. We'd go and we'd talk about how I teach, how they teach, and what things we need to work on. And so then we from that instance, figured out where the problems were, what things we could fix, what things we could change, what things we couldn't, and things like that. So it was definitely very collaborative. We took as much advice from every source we could, inside the community, outside the community, the government, Peace Corps, everyone, to try to come up with the best ideas about what can help our particular students. And I think our students were appreciative of us actually bringing them in the loop as well, because they helped plan some of the smaller projects and events we did so they could be more involved as well.
Great, good deal. Lucas?
Yeah, so in the first 3 months of arrival in country, we do our pre-service training, which is intensive on the technical knowledge and the language skills you're going to need throughout your 2 years of service. And so during that, we learned a lot about the Ministry of Health's findings for statistically where the highest rates of malaria were found, where we were having difficulty in providing proper nutrition for certain communities. And so by virtue of being a rural community health volunteer, we were always in areas that ended up meeting those same expectations, meeting those same needs as were professed by the Ministry of Health. And so the centering of our focus on community-based research, like Connor mentioned, for his time in Guyana, was similar in Benin. We tried to bring in as many members of the community as possible. Halfway through PST, we had a 2-week site visit where we stayed with a family in the town or the village that we would be living in for the next 2 years. And in that time, we are, asked to make as many connections as we can, talk to the political leaders, talk to the religious leaders, the community leaders in the schools and in the health centers, to really get an understanding of what resources the community has to offer in treating their own needs, and providing them the capacity to take the information that we have and using it themselves as, in the long run, when we as volunteers leave the country, we want these projects to be sustainable. And so bringing in the students themselves to learn how to make, for example, the foot-powered hand washing stations at the schools, at the marketplace and in their homes, gave them the skills to, and just told them that they had the opportunity, they had the skills already to take their community's health into their own hands, and moving forward, really be a guiding force in that subject area.
Great, thanks, Lucas. And Naomi?
Yeah, I think one of the things that helped a lot in as far as like organizing projects was, at least in Tanzania, we had the community entry passport, which at the time I didn't know was basically just a community needs assessment, which now doing my MPH is basically the basis for any type of public health intervention. But it was helpful to, there's a set of questions based around a lot of the core issues they wanted to do in Tanzania, like WASH, malaria, HIV, nutrition. But the big thing that was a big help for me was just being able to talk to the community. And it also forced us to go and talk to community in the first couple months at site when you don't know anyone. But knowing their perceptions, what they know, the level of resources was very important, because even now in the United States, a lot of what people believe and their accessibility to resources is what you base your interventions around, because you can only do a project with the cooperation with the community. Otherwise, you're just going in and telling people what to do, and they won't listen to what you want to say, because you need to have a two-way route. And also a lot of it, going off of what Lucas said, a lot of the times they have the skills because we don't know anything. We came from out of the country. So it's getting to know what they already know and helping them use what they already know to do things that help their community, because they're ultimately the experts.
Thanks, Naomi. I found out in just about every country I visited that they truly are the experts and we're the novices, and we have to listen to them. I mean, we have certain expertise, and that's why we're there, but we really have to pay attention to them. I'm going to move on to Kara now. This is the Tanzania trio here, Naomi, Kara, and Tracy. But Kara, you want to talk a little bit about how you came to understand the chief problems in your area?
Yeah, so again, also being in Tanzania, my experience is very similar to Naomi's. I would agree that the CEP, which is just a community needs assessment, basically, was very helpful with getting kind of more of a general knowledge of what the issues in the village might be. And the approach that I took in my village after I did my CEP, I was like, well, I really want like more like direct feedback from the people in my village. And at the time, I still didn't know a whole lot of people. So I approached my counterpart with the idea. I was like, hey, I kind of want to like boil down this like whole book into just like a few key questions that I would like to talk with people about. So we kind of came up with like a very like short, brief, like mini survey. And literally like 1 or 2 days a week, we would pick an area of the village and we'd be like, all right, we're just going to walk through and go introduce myself, say hi to people, and kind of get their feedback on like what they think that the village does very well and what they wish could be like better, or like what ideas that they had about potential projects that I could do and projects that they would be interested in seeing or taking a part of. And that was a really cool experience, both because like Naomi said, it kind of like forces you to get out and meet more people. People see your face, they kind of know like what you're about, that kind of thing. And I think people were kind of surprised at first that I was asking them what projects I should do, because they were like, oh, we thought that you were going to come and tell us what you were going to do. And I was like, no, I really want to work with you guys and know what you guys feel are like good ideas and good things to work on.
Great, thank you, Kara. And Tracy.
Thank you. I don't have a ton to add because I was also in Tanzania. So definitely during PST, learning from the Peace Corps staff, the APCDs, about some of the issues in the country and some of the challenges and how to work with the community was very helpful. The community entry passport for the first 3 months was also very effective. And I really appreciate your technique there, Kara. That was brilliant. What I did was I basically just went around, walked around in my village and hung out with people at their houses, talked to them, get to know them, integrate a little bit, and then ask them the questions, ask them what they want to see as projects or what they're focused on that could be feasible. A lot of people wanted to focus on water, but unfortunately for the scope of my service, that wasn't really feasible. So we were able to work together more to figure out what we could do the most effectively.
Thank you, Tracy. One of the things that I discovered was, because I looked so strange to many people when I was working primarily in East Africa, a lot in Tanzania, and that was, you know, we were strangers. We looked different than most of the villagers, et cetera. And so I always had a contingent of children. I was like the Pied Piper, and they would follow you all around the village. At some point in your comments today, could you address how that played out in your villages? But I think the next, we were thinking a little bit about how you started to come to realization that of how to address these needs. So kind of wrap that into the next question. But did you work interprofessionally with volunteers or NGOs? So many times we get in that little bubble of our own profession and that, but I'd like to hear some kind of interdisciplinary, interprofessional way that you worked in country. Let's see, I guess I'm gonna have to call on you guys. Let's start with Lucas this time.
Sounds good. So because I was the first volunteer on my site, a huge portion of my time was just introducing myself to the community. And so a lot of my intersectoral work was with other volunteers from their communities. I was not very close to any volunteers physically in terms of placement geographically, but the closest volunteer out was 2 hours away. And I did a monthly talk at his community organization. He was an agriculture volunteer focused on sustainable agriculture. And he was partnered with an orphanage in one of the bigger cities on the lower, southern part of the country. And so once a month, I went over to his site and, met his counterparts and spoke at the orphanage on different health topics. So 1 month we spoke on nutrition, 1 month we spoke on identification of the symptoms of malaria and how to prevent it, how to set up your insecticide treated bed nets, and how to repair any holes that might get in them so that you can protect yourself against malaria. And so the overlap between agriculture and health is obviously huge. And so they talk of, rural community health in Peace Corps speaks with the volunteers that work in the education department as well, that work in the agriculture department, to really, because health is the basis for everything. So they try to get at least a little component of health into every volunteer's workload. And so being able to partner with my buddy in a relatively nearby town for consistent work was fantastic, and seeing the audience size grow each month. So we started with just the children, and then various parents in the area, various teachers saw what we were doing and invited more parents, and that size grew. So you really got a feeling for how, like I said before, how the community is taking this work into their own hands to spread it and to continue the work after volunteers are all done, which is the most important part of all our service. So.
Kara, could you talk about how you worked with other disciplines, or at least people who had other issues besides just health?
Yeah, so on the project specifically that I'm talking about today, Huru International is based out of Kenya. And like I said, it's about teaching young girls about women's health and reproductive health. And so again, the big thing in Peace Corps is like, how can we make this more sustainable? Huru is kind of like a few months event. They get like supplies and then it's kind of done. And I was like, well, how can I make this more sustainable? So ideas that me and my counterparts had were turning it more into a school club, and expanding it to also do like monthly lessons at the clinic. And then talking with some of the Peace Corps volunteer leaders, I was talking with them about potentially doing a regional training within Singida, because we had quite a few volunteers within like 2 to 3 hours of each other at least. There were both health volunteers, ag volunteers, and then also the new cohort that came in was education volunteers. And so we in our group chat were kind of trying to see how we could organize things. We actually found a more local organization based out of Arusha, NGO, that actually was willing to come out and teach a local training in Singida about how to actually make reusable sanitary pads and do like more education. So that was a really cool experience. Unfortunately, because we got evacuated, I wasn't able to see it come to fruition. But it was cool working with other volunteers to try to like turn it into like a bigger, and again, try to be more sustainable.
Thank you. Naomi.
Yeah, like so in Lushoto, there's actually a lot more education volunteers than health agriculture. So like my site mate was an education volunteer. So around me, a lot of my connections with other volunteers was through schools. So besides just like my health, it's similar to like Luga, I can like help them with like maybe implementing some more health in their curriculum. But also we just had, because the proximity of the villages was pretty close, we had a strong network, but just having people in other villages that can communicate, we could have a bigger, wider range of projects. So like even like I did an orange flesh sweet potato project, but I was able to get the cuttings from another city, but also because I had some volunteers, I was able to rope them to be like, hey, I can provide some cuttings, so they're generally fairly cheap. But if you can provide the education course in your village, then I can give you some. So then we can expand it from not just one village, but into multiple villages in the area. And ideally, because like the orange flesh sweet potatoes are very quick to grow and easy to propagate, because you just cut the branches, like ideally it should be more sustainable. So like maybe we'll start with 2 and then move outwards, but that's only with the coordination with a lot of people in different villages. And usually, even if I don't have a direct relationship with them, because there's the network between schools, between like the clinic, you can use the people around you to kind of expand on something you started.
Did I'm just curious, were the people familiar with sweet potatoes in your area?
Like they're familiar with sweet potatoes, but the type we had, they were basically white. So they had very little like extra nutritional value. And the orange ones are the ones that are rich in vitamin A. So that's like one of the things that the Peace Corps is pushing, to kind of like maybe switch out the old type of potato with a new type of sweet potato that has more nutrients.
Great, great. I worked in Malawi with a gal that was trying to add more, help them grow more legumes with a higher protein content. You know, like you said, with the orange sweet potatoes having the higher vitamin A content. Tracy.
Thank you. I think, by the way, when we're talking about orange flesh sweet potatoes, Clement is our resident expert for the orange flesh sweet potato guru of Tanzania. And for interdisciplinary, there's definitely a lot of overlap between agriculture, health, and education. So a lot of my work involved all of those things, different counterparts in the community that I worked with a lot. Most of them are agriculture experts, but teachers also, and different NGOs have kind of overlap between all of those focuses. But if I may, I would like to pass it over to Clement to speak a little bit more about interdisciplinary and collaborations within Tanzania.
That'd be great. Clement, could you, the guru of orange sweet potatoes?
Yeah, well, this orange flesh sweet potatoes, I can say that they have been distributed almost all over the country now because of the good work of the volunteers and counterparts. Whenever they attend the trainings, I would make sure that every participant goes with several cuttings so that they plant them and then they distribute them in the villages. And this was a very cheap and easy way of addressing vitamin A deficiency, which is quite an issue in most villages. And anything you'd like to know about that? And again, this orange sweet potatoes, as one education volunteer mentioned, it was cross-cutting, that if education volunteers or health volunteers attend the training, then they go with the staff as a supplement or as a complementary staff. And personally, I'm very proud with the impact the volunteers have made in their villages with this type of sweet potatoes.
Thank you.
And another project, which many volunteers did, was on chicken projects. They worked quite a lot on that, and they have made impacts as well, where the volunteers have been introducing this type of projects, and they are still sustainable. They are still there until today. And the communities are always coming thankful to Peace Corps for this type of projects. And the beekeeping as well, beekeeping. A lot of volunteers did projects on beekeeping. And yeah.
Thank you, Clement.
Still working well.
Appreciate it.
Yep.
Let's move on to, I bookended this. I put Lucas first, and I'm going to put Connor last, so that bookend those three Tanzanians. Connor?
Yeah, so since I was a health sector volunteer that was working in a school, interdisciplinary work was actually required. So we almost immediately worked with the health clinic and the school together to try to combine those services. And also with my region, it was very small and there was a decent concentration of volunteers with education, health, and environment. So there was a lot of collaboration on all projects within the volunteers, because being able to collaborate literacy, health, and environmental awareness is very like helpful to combine them all, and they're very useful together. So we did do a lot of different projects with all the other volunteers sectors as well. And because we're in a school, I was able to use my health knowledge and combine it with the different aspects of the different whatever teachers I work with, whether it be physical education, history, social awareness, physical fitness, all these things. So even within the school itself, there was interdisciplinary, like knowledge collaborations with all the other teachers. Like it wasn't just I do my own thing. Like we'd all combine on different projects and work together. So it was very effective at trying to make it as broad as possible, yet still helping to advance all the projects.
You know, I'm just thinking after hearing all of you talk about the interdisciplinary work, a lot of disciplines on our campus and other campuses have trouble putting together interprofessional education programs. We should unleash the Peace Corps volunteers on those people, because they could teach some of our leaders more about how to do interdisciplinary training and education, like you guys have talked about your experiences in your various countries and placement. Let's see. There was one question about creativity, but I kind of heard about your creativity. So I want to move on, because I know we're getting a little short on time, but I'd like to hear, and maybe also from the counterparts. So Jimmy, is it Patricia Coates in Uganda, and Clement, something about what you would continue if you were going back to your country, or what you would maybe discontinue, what didn't seem to work as well, what worked even better than you imagined initially. So I'm gonna start with at least one of the Uganda people, let's say Naomi. If you could unmute and talk a little bit about, if you went back to your village, what would you continue? What would you discontinue?
Well, I'm with Tanzania, but it's hard to say because my time was like cut short. I would say definitely I did the orange fresh sweet potato. I did the wash, which was good. As far as like maybe not continuing, like a lot of the struggles were definitely with water security, which is like I think we're trying to phase out of like Tanzania a little bit because it's so hard to do. But definitely maybe try to do a way that we can work around it, or maybe improve on the project centered around it would be something.
Yeah.
Maybe.
When one of the projects when I was in Tanzania, well, our whole focus when I was in Tanzania was setting up HIV clinics and that. But like you said, water is such a need across a lot of Africa, and maybe even in Guyana and that, and in West Africa. We ended up, even though all our focus was supposed to be on HIV, putting in boreholes and you know, other kinds of things related to water and that. So I can kind of understand that. Tracy, what would you do? What would you continue? What would you discontinue?
Thank you. So one thing that I would definitely continue, I wish I would have started it sooner, is I was doing a program called Men as Partners. And this is basically, we went to a training, one of my counterparts from my village and it's kind of for men, respected men in the village, to learn about different like health topics such as HIV and AIDS and kind of gender respect, gender equality, and like family health, and then go back to the village and have discussions with other men specifically, because a lot of times for like gender empowerment, we focus on the women, but really we need to bring in the men into the conversation, and then come all together. And so this is something that I started towards the end of my service, and then we were evacuated, so it was even shorter. But this is definitely something I would continue. My counterpart was continuing it for a little while, but then he actually moved to Mbalizi, which is a larger town outside of my village. And so he's not in my village anymore, but I hope that they're still having those conversations. And something to discontinue, I couldn't tell you. I think that everything could just keep going in the right direction.
Okay, let's shift to Lucas.
Yeah, I think my favorite part of being an RCH volunteer was the focus on the care group model of education, which is centered around finding respected female community leaders in your area. So in my particular village, right behind my house, there was a weekly meeting of women leaders in the community on saving money, more or less. Very economically focused on gathering money. It was a community-based effort to fund entrepreneurial efforts by each individual. So that was already in existence when I showed up for years, and so it was very easy for me to integrate into that particular group and implement the care group model, which was every other week I would meet with them and we would discuss a health topic of importance to them. Throughout the next 2 weeks, they would go through each leader mama, as we called them, was tasked with distributing that particular knowledge to 10 other families. And so in that way, our small group of 12 people, the 10 mamas in the group, myself and my counterpart, we were able to reach 100 households on important topics such as, like I mentioned before, nutrition, malaria, safe sex practices, etc. And so in that very small group, everyone got to know each other, and every other week they would come back and discuss difficulties they had in getting information across, shared questions that their particular households had regarding the information, and they would discuss amongst themselves the best way to share that information. And so, that really drove home the point of sustainability and community capacity in a way that I really liked. So I would, highlight that even further for the future RCH volunteers in Benin. And like Tracy, I can't think of anything that I would discontinue right off the bat.
Great. Connor?
So for me, the thing I want to continue would be something that we were supposed to start our second year, and I did, and it was very successful, but because of the pandemic, it had to, because we got evacuated right as the country shut down. So they stopped school and everything for a while. So my project was a adolescent health clinic. So every Wednesday after school, our health clinic was about 5-minute walk from the school. So we'd walk a bunch of students over, and the nurses and I would have some sort of presentation or activity where we basically give the kids more information about whatever health topic they chose the week before. And it would give more in-depth detail in the health sense, not just like a teacher sense, but they could ask any question. There was nothing they couldn't ask. And we also provided services like condoms, IUDs, and all different, and birth control and things like that. So they could look, see, and talk about these other health aspects that they haven't been able to see. And it was very successful. It was starting to pick up. And then I was evacuated. So unfortunately that has stopped because everything was shut down. But I hope that, I don't know if it'll be able to get back because of the pandemic, a lot of the nurses and the teachers had to move around. So it'll probably won't continue, but I would love for it to continue. And for discontinue, there's not really much that I'd want to discontinue, maybe shift around a little bit, priorities and timing of certain things, just to make it flow better. But for the most part, everything worked well that we did. So I don't think anything I'd really want to discontinue.
Thanks, Connor. And Kara?
So as far as something to continue, or something that I wish that I had started earlier, again, I lived right next to the school. So I did a lot of health lessons and smaller projects, as well as the bigger one with the nearby school. And so I spent a lot of time with the students, both doing the lessons, and they would come by my house whenever to say hey and hang out. And as I got to know them more, I felt like they kind of really came out of their shell. So further along in my service, when I would do like health lessons or like smaller projects, I would pick out like student leaders because I'd be like, I know such and such. Think that they would be great at this. I'd be like, come up and like try to do this demonstration or like teach what you know back to like your friends or like other students. And I think at first they were kind of wary of it, but then like it really started to I think pick up, and they started to like enjoy it more because they were more involved and felt like they were now the teacher, which isn't a role that they necessarily get to play a whole lot. So that's definitely something that if like I could go back, I would like implement earlier, because I think a lot of times the students, they do know a lot and they're very creative, but they can be really shy, especially when it comes to like in front of like authority figures like teachers or even like me or other people. So I think that that was great. As far as things to discontinue, again, I feel like everybody else, I can't really think of something specific. Maybe like was said before, maybe just like shift around priorities or things that I would have like did earlier or maybe waited later, that kind of thing.
Great. I would like, the last question I have, I'm going to address to the counterparts, because a number of you were evacuated early because of COVID. And I would just like about, let's see, we're almost out of time. So maybe Jimmy, Clement, and Coatus, if you could just talk about how the pandemic is in your country at the moment, and you know, what might need to be done in order to get Peace Corps back in your country. So let's start with, is it Coatus? Is that how you pronounce your name?
Okay, my name is Cautious.
Cautious.
Yes. Thank you very much. Yes, thank you very much. Yeah, the pandemic since last year, March, we had an evacuation. And right now we are just in our second wave, and the curve is going a little down at about 5% incidence rate. And yeah, we have the second wave has really hit us bad with a lot of death this time and a lot of new cases than the first wave. However, from the program perspective, when we, after evacuation, as a program, for example, the health program, we had to sit down and do the inventory of all our sites and what each volunteer was doing at each site. So we had what we call our site placement was kind of focused, and it was in line with our framework. So we had the sites that we knew were focusing on OVC, that is orphans and vulnerable children, and youth and HIV, maternal child health, and then capacity building. So we had an inventory of all our sites. And then we also looked at which activities volunteers were working on before evacuation and which pending activities, because some volunteers had to withdraw some grants that were at the beginning or in the middle or about to close. So once we did that, then we sat with administration and were able to design the concept notes. So we got support from headquarters because Uganda is a PEPFAR country. And right now we are still expected to report under PEPFAR indicators, much as we don't have volunteers in country. So we reached out to different partners and we put together concept notes. One, to continue with those continuous activities, because if you have an orphan and vulnerable child, at this point in time, that's when they really need support. They need nutrition, they need health services, they need to take their ARVs and access them. So we've been actually working very closely with our partners. We've had our quarterly meetings with them for us to continue motivating them, but also continuing with Peace Corps work, so that when we have our volunteers ready to return, we have a starting point. We are introducing the model. We had done it before, but now I think we are planning to take it on of the starter, career, and finisher. And at those different sites, we had volunteers with different generations. Some were like the first volunteers at those very sites. Others were like the second volunteers, others were like the third volunteers, or maybe the site has had volunteers many times. So yeah, we are looking at that, but also we are considering the country specific needs, but also the expectations from PEPFAR, which is 100% our funding partner as a health program. So just to say that things are going on, not as smooth as we expected, but there is some work going on. And we also,
Cautious.
yeah.
I appreciate it. Jimmy, could you just, we're actually over time, but if you could just summarize a little bit about how you see COVID in your country and how you would welcome back Peace Corps volunteers when the pandemic seems to be under control.
Thank you, Dr. Barbara. But this point in time, I would like to welcome Clement Marandu, who is very close working with Peace Corps because I left Peace Corps 8 months ago joining UNHCR. So Clement is best placed because he has some background of what they've done to in order to prepare the return of volunteers. Clement, please. Thank you.
Thank you, Jimmy. And Clement?
Yeah, thank you. Presently, although we don't have volunteers in the country, but there are
Clement, I think you're. Not quite sure what happened to Clement.
Clement, we can't hear you.
Well, I think we need to move on to closure here. I wanted to thank all of the Coverdales and also their counterparts, as well as Patricia Roque and let's see, I guess I should even thank Jesse for trying to organize this, and well, not trying, he did organize it. So anyhow, I'll turn it back over to Jesse for any final words.
Okay, so 2 quick things. We want to take a group photo with everyone if possible. So if you can please turn your cameras on so that we can see you, and we'll take a few screenshots.
Jimmy?
Okay, we've got Jimmy.
Cautious?
I think, yeah, Cautious is turning on her camera.
My camera is on, but surprisingly, it's not showing me.
Okay,
I don't know. I'm just seeing the black thing. It's on. Maybe the photo is coming.
we'll give it 1 second for that to go through. So thank you, everyone. This has been a fantastic conversation, and really glad that we're able to to have a conversation specifically with some of the program managers and counterparts around the world. And we're going to continue this series. This is just the beginning of the entire series project, and we will be reaching out. Oh, Cautious,
there she is.
There you go. So we'll take a few quick group photos, and again, as a reminder, this will be on our website, which we'll send out to everyone, and we'll make it available to whomever wants a copy of the video as well. So thank you,
Jimmy,
everyone.
where did you go, Jimmy?
We got Jimmy and Clement. Oh, Clement is back.
Yeah, I'm here.
Okay, please turn your cameras on.
Yes, and we'll take.
I'm using
There's
my
Jimmy.
phone.
Okay, that's fine, Clement. All right, and so we're
Yeah.
going to take a few screenshots. So on the count of 3, everyone smile. 1, 2, 3. Okay. Thank you, everyone. We really appreciate your time and your efforts, and we are going to be reaching out with more information in the future, and we're going to continue this series. So,
Thanks again.
bye,
Thank
everyone.
you.
Thank you,
Thank
everyone.
Thank you.
Bye-bye.
Asante sana.
Thank you.
Okay, thank you.
Karibu.
Asante sana, Zikomo.
But I've been nimekuwa disconnected kidogo. That's very unfortunate.
Thank you
But
all
well, I
for
think
a fantastic session.
the call was really good. I love it.
Thank you.
Thank you.
When do you have
You're
the
invited
next
back,
call?
Clement.
Yeah, when do you have the next call?
We're going to plan that. We're going to have it in the fall semester. We'll have several more calls like this.
Thank you so much. I'll be available.
Yes.
Hongera sana Gustavo Clements.
Asante Trace, lakini bado nipo, bado Peace Corps ameniomba nifanye kazi.
Oh, Clement just retired. So I was just saying congratulations. He just retired from Peace Corps.
Ah,
Congratulations, Clement.
But
Bye, everyone.